I wanted to begin just this morning, before we go to our experts, I'd like to just begin by clarifying some of the terminology. I think it would be really important. Already in the title of the webinar, we've mentioned the words e-health and medtech, and throughout the webinar today, you'll hear telemedicine, telehealth, and many other words to describe technology in the medical sphere. I guess in the industry, a lot of these words are just used interchangeably, and as a general rule, it's okay and widely acceptable. But if we have a look at the actual definitions, it might give us a little bit of clarity to begin with. So medtech, we might have heard the term fintech, so a financial banking application would be under fintech. Anything under medtech is actually the use of technology in caregiving for patients and the medical sector. E-health is the healthcare services provided electronically by the internet, and the term e-health, I guess, refers to the use of IT to increase the efficiency as a whole of the medical industry, and I think it covers things like the use of electronic health records, electronic prescriptions, the use of AI in diagnoses, and we'll talk a lot about this shortly with Dr. Perugini. But whatever terms we use, we can be sure that the technology is going to continue to be taken advantage of and adopted by medical clinics, hospitals, and caregivers as a whole. So we have the words telemedicine, the remote diagnosis and treatment of patients via telecommunications. So even, I know in Poland actually, medical clinics have locked the doors, and if you want to go see the doctor first, there's a teleconsult. And for those who don't have software to do these consultations, the telephone is being used, and this has been used for decades now in terms of dealing with remote patients. And telehealth, it includes telemedicine, but it also includes all the other non-clinical services like provider training and conducting meetings and medical training. So